What we use as a diagnostic criteria is based on the DSM-5, which is the Diagnostic and Statistical Manual of Mental Health. And it's version 5 that we're currently using, mental disorders. So that's what we base the diagnosis on, and that's what we look for. When somebody walks in and says that my child may have ADHD, or I might have ADHD, then that's what I'm looking out for. It's a multi-step process. It's not somebody walks in and you do an interview and that's finished. What DSM-5 says is that what we're looking for is that there are a number of symptoms. Firstly, there are 3 types of ADHD. It's either the hyperactive type, or it's the inattentive type, or it is the combined, which is the inattentive and hyperactive or impulsive. So there are 3 types of ADHD. What we're looking for example, for the inattentive type is that these have been present for at least 6 months, and these symptoms have been there and they were present before somebody turned 12. It is a childhood neurodevelopmental disorder. You don't suddenly get it when you're an adult. It has to be there throughout your childhood. So they often fails to give close attention or detail and makes careless mistakes in schoolwork or at work or with activities, trouble holding attention on task or play activities, doesn't seem to listen when spoken to directly, often doesn't follow through instructions or fails to finish schoolwork, chores or duties in the workplace, trouble organizing activities and tasks, avoids, dislikes or is reluctant to do tasks that require mental effort over a long period of time. So sustaining attention is difficult. Maintaining the focus is difficult, and your mind wanders easily, often easily distracted, often is forgetful in daily activities, often loses things necessary for tasks and activities. So there is the disorganization part and there is the inattentive part. That's the list that we're looking for the symptoms. Inattention. For the hyperactivity and impulsivity, often fidgets or taps hands, feet, or squirms in the seat, often leaves seat in situations when remaining seated is expected, often runs about or climbs in situations where it's not appropriate. And adolescents or adults may be limited just to feeling restless, because as you get older, you do learn to manage to sit not so much still, but you're still restless, but you can sit. You don't have to move around. Often unable to play or take part in leisure activities quietly, is often on the go as if driven by the motor, often talks excessively, that's the impulsive, often blurts out an answer before the question has been completed, often has trouble waiting their turn, often interrupts or intrudes on others, so butts into conversations and can't wait for their turn. So these are the things that we're looking out for. Now, how they manifest in children and adults, in boys and girls, is very different at a different developmental age. And again, I have to emphasize, it is a neurodevelopmental disorder, and it has to be present before you turn 12. Now, today, when you look at most of the inattentive part, most of us could probably be diagnosed with it, because we do find it difficult to pay attention, keep sustained attention on a task, because we've been trained to scroll. And, it is challenging for us to just stay focused because of the fantastic access to the iPhone and the technology, and we all get easily bored, and especially after the pandemic and having spent so much time on the screen. Yes, people who wouldn't have been diagnosed with ADHD certainly could be now. That's why I emphasize that it has to be present in your younger years. It doesn't suddenly come about when you're an adult. It can get missed if it is mild, or especially in girls, it can sometimes get missed because they don't present with hyperactivity as much as the boys. And that's why historically more boys have been identified earlier than the girls. With the girls, what I see is that when it comes to academic pressures around 14, 15, 16, or their social circle where they blurt out, often say things without thinking about it, and social setting is impacted. So it does present differently in boys and girls.